Good afternoon, everyone, and thank you very much for inviting me this afternoon. I will be talking about systems leadership and what it can do and why it's so important for citizens to be involved in leadership of places. But I wanted to start off talking about cities and place, and I wanted to start out with a bit of a warning, because where you live can seriously damage your health. In most cities, and Bristol is included in this, there are serious disparities in life expectancy between the poorest part of the city and the richest part. One person who has really grasped this with a vengeance is Michael Marmot, who, amongst his distinguished career, is currently a Professor of Public Health and Epidemiology at UCL in London. And in his most recent book, he brings this out with a vengeance, and I wanted just to read a paragraph because this really shows what I mean. He's talking about Glasgow, and a Scottish professor wrote to him, I know you have been contrasting shockingly poor health in Carlton, a poor part of Glasgow, with the estimable health of Lenzie, a richer part of Glasgow. We talk about it in Glasgow, even in the pub, especially in Carlton, as people raise their glasses to the memory of drinkers past, so many of them gone. I live in Lenzie and drink regularly in the pub with a friend who lives in Carlton. We were chatting the other night, and it turned out that my friend had no plans for pension or other retirement arrangements. When I asked him why not, he said, it's because I'm 54. 54 is the average male life expectancy in Carlton, in Glasgow. It's an extreme example, but it brings out the point. And more recently at the University of Bristol, Professor David Gordon and his colleagues have made the link with place explicit. So they have revisited the CMO's, the Chief Medical Officer's top tips for health. Don't be poor. If you can, stop. If you can't, try not to be poor for long. Don't live in a deprived area. If you do, of course, move. And don't live in damp, low-quality housing or be homeless. Government, the NHS, built environment professionals, health professionals generally, all get this. They all understand this link between place and cities and health and well-being and life expectancy very, very well. So the NHS, for example, as part of its 5-year forward view, has a Healthy New Towns programme, where it says, amongst other things, good urban and housing design promotes healthy lifestyles and can help prevent illness. So this is not just about treatment, this is about preventing people getting sick in the first place. And it is explicitly now written into law in the Care Act 2014, which states housing is a crucial health-related service, which is to be integrated with care and support and health services. And interestingly, many housing associations are now really taking this on board and are playing a leading role in promoting health and general well-being. But actually, my point is, this is too good a point to be left to the NHS and to government, both local and national, and to professionals. Citizens, wherever they are, whoever they are, understand this link all too well as well. If you are a mother of a child and you're in a place that is damp and suffers from mould, you will understand that link more often than not when your child develops bronchial illnesses or asthma or related illnesses. And that is why I think it's so important to have the public at the absolute centre of changes to cities and to places where they live. This means using what we call systems leadership, and this is at the heart of the work I'm involved with. Systems leadership is an approach to leadership that you use when you are facing situations that are inherently complex and difficult, and when you are not in charge. And it's about getting as many people around the table as possible, and not so much providing straightforward answers as asking questions. It's about emphasising the real work, not the pretend work that goes around just having endless meetings. And it's not just placing citizens at the centre. It's saying, you know what, citizens are the centre. We start with the citizen. So it's about influence, and it's about telling stories, and it's about framing things in ways which says this is emotionally resonant, this is what this means. It's also about sharing leadership, not just trading leadership, but truly sharing it, giving it away, so that paradoxically you have more control. There are many, many examples, both from research and from practice and from evaluation, that this approach really works and that it pays dividends to have citizens at the centre right from the start. And I'd be happy to talk about this in more detail when we discuss it at the panel. But I'm now going to sort of hand over to the rest of the panel who are going to say, this is what it means in practice. Thank you. Lovely.